Okay, lecture 1, titled Dietary Therapy 1, coronary heart disease. It's mostly going to talk about CHD. We'll come back and talk about dietary therapy in a more rounded sense a little bit later on. Okay, this is what we're going to be looking at. What CHD is, nutritional issues, prevention, with a digression on so-called good and so-called bad cholesterol. So, CHD. These are the basic statistics from the British Heart Foundation. CHD is a leading cause of death in Western countries and is increasingly common in the rest of the world, including developing countries. This is very probably associated with changes in lifestyle, in particular in diet. For more information, there is information under the images as usual. This is from the BNF resource. It's included just as a reminder, you probably covered this earlier. When discussing issues like this, it's always a good idea to address the fundamentals. In this case, heart anatomy in action, and then consider the heart health issues. So if you're writing this up for your assignment, for example. Atherosclerosis is a potentially serious condition where arteries become clogged with fatty substances called plaque, sometimes erythema. These plaques lead to the narrowing of arteries, restricting blood flow to organs, including the heart. If plaque becomes detached from the arterial wall, this can lead to blood clots forming elsewhere. So atherosclerosis is often symptom-free until life-threatening events like heart attack or stroke. In stroke, the blood supply to the part of the brain is cut off, leading to serious and often very long-term health effects. For a good review of atherosclerosis, see this video from the consistently excellent Armando has undergone. Always well worth watching his information. Okay, if you're interested, the BHF has a free course for anyone who wants to learn more about the heart and circulatory diseases and what causes them. The course runs over a period of 3 weeks, but you can learn at a pace that suits you. So this is maybe a good summer option for students interested in dietetics and public health in general. Here's a bit of a flashback. You may recall this slide from last year's epidemiology lecture in Lifestyle and Health. A range of risk factors increase the incidence of developing a condition. It's a complex relationship, generally, and the best evidence is at population level. However, the evidence around CHD and risk and preventive factors is well established. As I mentioned, we'll look at nutrient therapy for CHD in a later resource. Again, we looked at this paper last year, and I'll put the link is there from here and also put it in the resources. This paper discussed, among things, a long latency period of non-communicable diseases and the classification of risk factors such as for CHD here. Recall that although some factors such as genetics are non-modifiable, there are several well-established major modifiable risk factors, including diet. And it's also arguable that the so-called non-modifiable factors may be addressed in public health approaches in general. Okay, so nutritional issues, which I'm sure you're very familiar with. Other lifestyle factors noted are important, but we'll focus on diet, both in terms of prevention and treatment. A low-fat, high-fibre diet is recommended, which should include plenty of fresh fruit and vegetables, at least 5 portions a day, and whole grains. Salt should be limited to more than 6 grams daily, which is well below the average for this country. Saturated fats should be avoided since they are associated with increased levels of so-called bad cholesterol in the blood. More on this in a moment. Reducing sugar, drinking alcohol moderately are also recommended. Okay, so cholesterol. Cholesterol is a waxy solid first found in gallstones way back in 1784. Though they didn't know what its structure was then, of course. Cholesterol can precipitate as gallstones, which are these things here, which can obstruct the bile duct, leading to jaundice. Obstruction of the pancreas can lead to pancreatitis. They range in size from the grain of sand to a golf ball. In the image, the scale is in inches, so these are quite spectacular. It's worth noting that the majority of cholesterol, which we need for a range of reasons, including vitamin D synthesis, is synthesized in the body, which does bring into question the validity of low cholesterol diets, but that's a bit outside the scope here. So cholesterol is hydrophobic and is carried through the bloodstream in protein packages called lipoproteins. 2 kinds of lipoproteins carry cholesterol through the body: high-density lipoproteins, HDL, and low-density lipoproteins, LDL. And there's plenty of resources if you want to dig more into the structure and function of both HDL and LDL. They have different structures and roles. The main role of LDL is to transport cholesterol from its synthesis in the liver to the tissues. HDL can be said to carry out the reverse process. It absorbs cholesterol and returns it to the liver, either for hydrolysis presumably or for storage. High LDL cholesterol leads to a buildup of cholesterol in the arteries, hence it's sometimes called bad cholesterol. This is, as noted, something of a misnomer. Its issue is its level rather than its general biological role. The higher LDL level in your blood, the greater chance you have of getting heart disease. HDL cholesterol is sometimes called good cholesterol. HDL carries cholesterol, as mentioned, from other parts of the body back to your liver. Liver removes cholesterol from your body, and it's generally assumed that a higher HDL cholesterol level, the lower your chance of getting heart disease. When there is too much LDL cholesterol in your body, because of diet, possibly in the rate at which cholesterol is processed, it is deposited in arteries, including those of the heart, as we've discussed earlier, which can lead to narrowing of the arteries and heart disease. Studies of people with heart disease have shown that lowering cholesterol LDL reduces the risk of dying from heart disease, having a heart attack, or needing heart bypass or angioplasty, that is surgery to widen, narrow or obstructed arteries. Cholesterol levels are measured in milligrams of cholesterol per deciliter. A deciliter is 100 mils of blood, and there's some examples for an adult with or without existing heart disease. Here's some example results. This male subject has high borderline cholesterol and high LDL levels. However, the fact that his HDL is elevated is a benefit to him. Okay, as I mentioned, we'll review dietary therapy for patients with CHD later in the module. Thanks for listening.